Hi, this is Dr. Salibi with another episode of A Moment with Dr. Salibi. So today we're going to talk about the other drug that I mentioned in an article about two of the most dangerous drugs that are overprescribed in America. In our last podcast, we talked about statin drug therapy, and this time we're going to be talking about proton pump inhibitors or PPIs. There are several drugs in this class dating back to 1979, and this is a drug that is used to treat reflux or GERD, gastroesophageal reflux disease, or commonly known as heartburn. It is also used to treat gastric ulcers and is also commonly prescribed with other medications to treat and try to eradicate H. pylori. H. pylori has been implicated in gastric ulcers, but that's a lecture for another time. So the proton pump inhibitors reduce the production of stomach acids by shutting off the parietal cells found in the stomach lining. They also affect the production of intrinsic factor that is required for the absorption of B12, vitamin B12, and we'll talk about that in a minute. So you have the theory where you have no acid in the stomach by using proton pump inhibitors. There's no burn, and so there's no problem. So problem solved. Or is it? This is why the prescription of over-the-counter drugs like Prevacid, Nexium, Prilosec, GERD, and also the prescription drugs Dexilant, Protonix, and Acifex. These are given mostly orally, but they can be given IV in a hospital setting. And that's what makes these big sellers. Prilosec was the first proton pump inhibitor developed in 1979, and it heralded the use of these drugs to quote-unquote fix GERD. In 2017, sales of Prilosec globally reached over $2.6 billion. The other thing you might notice is Larry the Cable Guy. He's a comedian, and he's pitching the use of Prilosec and other PPI, proton pump inhibitors. This is ridiculous. His language and his charisma are converting people away from eating correctly and having an attitude of, well, you don't care what you eat because we've got a purple pill that'll fix your problems. That's really bad advice. Let's talk about some of the problems associated with proton pump inhibitors. And all that I'm quoting here is actually evident in evidence-based medicine literary magazines or journals, medical journals. So this is not just hearsay or wishful thinking. This is backed up by published scientific study. PPIs are known to have issues with kidney disease, acute interstitial nephritis, hypomagnesemia, which means low magnesium levels in the bloodstream, reduction of iron and zinc absorption, and those are two critically important elements for good health. It has also been implicated in certain cancers. There's a high risk of neoplasia, gastric carcinoma, tumors, and gastric cancer. Also, fractures of the bones and bone thinning, often referred to as osteoporosis, have been implicated and linked to PPI use. Also, an increase in infections and in particular pneumonia. More side effects of PPIs include Clostridium difficile infections in the gut. And these are all other types of enteric infections as well. Adverse prenatal, perinatal, and postnatal events when used in the pregnant female. Also, vitamin deficiencies, as I mentioned earlier, because the proton pump inhibitors knock out the parietal cells which produce intrinsic factor, which is necessary for the absorption of vitamin B12 in our diet. And this possibly also affects other B-complex vitamins. Thrombotic events or clotting events due to interactions with the drug clopidogrel, also known as Plavix. There is that drug-drug interaction. And there has been noted an increase in dementia with long-term use of PPIs. Also, more recently, it's been shown that there may be an increased risk of adverse cardiac events. Addressing GERD or reflux or heartburn should start with a very good detailed history by your practitioner, not just a 3-minute encounter where they throw a prescription for a PPI at you, but we really need to inquire as to a good history to determine if there are any aggravating factors, such as tobacco use, nicotine, for example, it impedes the function of the lower esophageal sphincter, increasing reflux. Alcohol beverages do the same thing. Fast food and processed foods are notorious. Eating too much and too fast, and also body position and body habitus. Folks that are a little bit obese sometimes have more problems with reflux just because of intra-abdominal pressures. And body position, I'm talking about the posture, and also if you're supine shortly after consuming food, and can lead to more problems with reflux. The next thing is you want to determine any non-pharmacological interventions, such as smaller meals, healthier diet, removing the offending triggers like alcohol and tobacco, waiting at least 2 hours before you recline after a meal. And there is a surgical procedure called a Nissen fundoplication, which can be a surgical option for treatment of reflux. Also consider H2 blockers. This drug class actually preceded PPIs and may be safer, although Zantac was recently dinged because of adulterants found in some of the brand name products that can cause cancer. Herbal remedies is another option, and the use of probiotics, and there are many to choose from, and there are some that are designed specifically for certain conditions like reflux, in combination or alone with digestive enzymes. For more information about the treatment of GERD and reflux and heartburn, please contact our office. Our providers are very well adept at evaluating patients, determining if in fact reflux is the condition, making sure it's not something like a cardiac issue that's causing the discomfort in the chest, using or recommending a scope, upper endoscopy, barium studies, and other studies like dropping a acid meter in the esophagus to determine where and how bad the acid is that's refluxing up there. Once that determination is made, then we can help our patients determine the most appropriate and the safest therapy for them.